Joining us right now is Chief Minister of Meghalaya, Mr. Conrad Sangma. Thank you very much, Mr. Sangma, for joining us and speaking to us. You've constantly been pushing to ensure healthcare as a sector is bolstered in Meghalaya, your state, and there is improved healthcare accessibility in your state. Can you tell us about the challenges that you have faced in this process? I mean, we can start with three.
So first of all, thank you so much for having me on the show, and thank you for always hosting this program every Gandhi Jayanti. And I wish all of you a very happy and a meaningful Gandhi Jayanti. This is a new chapter in one sense because you have started the health aspect this year, and it's very crucial because health is, of course, one of the most important social sectors for any government to provide to the people in the society. But Meghalaya, of course, being a very difficult terrain, we have different challenges compared to other parts of the country. First of all, of course, remoteness. Our villages are very, very remote. Being a small state, in spite of that, we have 6,800 villages in our state, and hence connectivity to these villages becomes an issue. Technology plays an important role. So we are using drones, for example, today to deliver medicines to different locations. So those kind of challenges are there. Number two, in large infrastructure. So we have a large number of villages, and hence we need large number of infrastructures, sub-centers, PHCs, CHCs. So for that also, in the last 5 years, since we've been in the government, this is our second term, we have been focusing a lot on improving the overall infrastructure to the grassroots level. Third, and the very most important part, is the manpower. We have had a huge shortage of doctors, but in the last 5 years, we have reformed the overall recruitment process by coming up with recruitment boards that will allow the recruitment of doctors in a very, very swift manner. So today, in a matter of 2 months' time in the last couple of years, we were able to appoint and give all the doctors in all the centers that were required. So these were the basic challenges, but of course there are many more, but I would say these would be the most important ones.
Mr. Sangma, I have actually shot in Meghalaya, Shillong, around a lot of areas in the villages for my film Anek, and we've been also reading that one of the key initiatives you have taken is the establishment of a public health and specialist cadre system within the medical department. So what will this do and how will it help?
Yes, Ayushmann, I've seen your movie, so it was very nice. So great to see you again. But yes, the overall recruitment system and the entire specialist cadre system that we have is allowing us to, in fact, address the major issue, which I said, of manpower. And no matter what kind of infrastructures you have, no matter what kind of accessibility that is there, ultimately it boils down to the manpower requirement. And hence, this entire system that we've created has allowed us now to almost completely have the necessary manpower. Of course, training processes are continuous processes. But to a large extent, we have been able to resolve the issue of manpower by following this new system.
Mr. Sangma, in terms of collaboration, are you working with the central government or other partners to improve healthcare in the state? Could you please tell us more about it?
Yes, because partnerships are very important. And no matter what a state government does, at the end of the day, if we do not have partners to work with us, we will not be able to achieve the goals that we would like to achieve and provide the service to the people. Central government is very, very supportive in many, many ways, many programs, guiding us all the time, monitoring the situation. Honorable Prime Minister himself personally looks into it. So these are very, very important partnerships, of course. We have a large number of NGOs and different CSR activities that are going on with private sector and with the different NGOs, as I mentioned. And the most important partnership actually we have is actually with the villagers. So I told you that we have 6,800 villages. You'll be happy to know that we have a village health council in every village. And this village health council works in partnership with the government. This is a council that is run by the people. And we support them financially. We give them a manual to be followed on how cleanliness should be done, how health checkups should be done. and what is the different actions they can take in terms of work when small issues are there in the village level. So the grassroots presence and the partnership with the villagers and the community is most probably one of the most important and the most powerful partnerships that we have. And it's one of the unique models, I should say, in the country. And I hope that this will also set an example for other states to follow.
Thank you, Mr. Sangma, for enlightening us and being on the show. Thank you so much.
Thank you so much, Ayushmann. Thank you so much.